Everyone, and thank you for tuning in. My name is Ashish Havanur, and I'm a rising junior at Vista Lago High School in Folsom, California. And today I'm going to be talking a little bit about the opioid epidemic, specifically in the US. And I'm going to be talking a little bit about my project also, which is more community oriented but pertaining to the opioid epidemic. So first, a little bit about me. Like I mentioned, I'm a rising junior at Vista Lago High School in Folsom, California. Right now, I'm working part-time as a medical scribe, and I'm completing a preceptorship at a large hospital. I was a student speaker at the GHLC 2024, and right now I'm currently working towards my Eagle Scout project and my Eagle Scout rank. I'm passionate about healthcare, and I hope to enter the medical field someday. So before we dive into the opioid epidemic, I think it's kind of important to understand what an opioid is and how it kind of works in our body after we take it. So essentially, opioids are drugs derived from or mimicking the opium poppy plant. They could be natural, synthetic, or semi-synthetic, and they can be prescribed legally for pain relief, such as after surgery when you're in immense pain. But they also exist illegally, like drugs like heroin. But how do opioids work? So essentially, opioids attach to receptors in the brain and body, including the reward centers, and this essentially blocks pain signals, providing relief. But when they reach the brain's pleasure centers, they produce what's described as a high. So this kind of shows us that. So endorphins are essentially, you could call them natural opioids. So they exist in our body, and we all have them, and they are tasked with essentially providing us with some dopamine stimulation, which essentially contributes to pleasure in a sense. And then we can see the brain on opioids. There's an excessive stimulation of the dopamine reward system, which means there's a heightened sense of like pain relief, and then again that feeling of the high. So this is kind of where the problem starts to arise. And one of those major problems is the overdose. So an overdose occurs when someone uses too much of an opioid or a combination of drugs to achieve that sort of high that I was talking about earlier. And the most common causes include heroin use or street drugs, which are essentially illegally bought drugs that are laced with fentanyl. So when an overdose happens, opioids essentially flood every receptor in the body, slowing breathing to a very life-threatening level. And so this infographic kind of shows us this. So these are the opioid receptors in the brain. And so what the opioids do is they fit exactly into the receptors, and this essentially slows the breathing down to a very, very dangerous level. And so another very important thing to sort of touch upon here is fentanyl. So fentanyl is particularly dangerous because it's extremely potent. It's far stronger than most drugs. And when prescribed and regulated, fentanyl can be safe. But illicitly manufactured fentanyl is the concern here, and it is often mixed into other drugs, creating lethal doses without the user's knowledge. And so this kind of shows us that. So this is a lethal dose of fentanyl. As you can see, it's literally like a few grams. It's like a few grains. It's literally like a few grains of salt. And so this is literally what we're dealing with here. So if this was in a street drug, no one would have the capacity to tell if this was laced or not. And so these stats kind of help to represent that. So this is overdoses in general, not fentanyl specific, but these are fentanyl specific. So over 100,000 people in the US died from a drug-related overdose in 2023. And in the same year, over 70K people died from a drug overdose that involved fentanyl. And this just really shows the magnitude, the scope of the issue. So this graph also kind of shows the gradual progression of overdoses over time. And as you can see, they really started to increase, specifically increasing around 2020. But they have decreased a little bit, as you can see here, in 2023, and they have been decreasing in 2024 as well. It's just not listed in this graph. So that's good, but we're still not at a level where we need to be. We should be ideally very, very low. But fortunately, going back to the overdose situation, overdoses doesn't have to mean death. If symptoms are recognized quickly, Narcan, also known as naloxone, can reverse the effects. So naloxone essentially works by binding to opioid receptors, kicking the opioids off, and restoring normal breathing. So Narcan comes in an injection or a nasal spray, the latter being the most common in schools and workplaces. So what's unique about Narcan is that it has no effect on someone who has an overdose. This means that it can be administered without hesitation, even if you're unsure about whether they overdose or not. If it's an overdose, that means you'll save their life by administering Narcan. And so this infographic kind of shows us that Narcan. So As you can see, these are the opioids, but the Narcan, what it does is it's more potent than the um, opioid. Potent in the sense that it's not harmful. But it's just more attractive to the receptors than the opioid. So what it essentially does is the opioids get kicked off, and the Narcan takes its place, essentially restoring a normal breathing pattern, which is good. And so, to kind of bring it all together, the opioid epidemic is something that's really complex, but one key solution is prevention, and that's sort of where I want to start talking about my project. So, I created a series of educational videos, and it's under the Learn, Inform, First Response, and Empower project. And essentially, I created a series of educational videos to inform students about the crisis. Of opioids from a peer perspective. So I interviewed doctors and police officers on the front lines of the epidemic, and I distributed a supplemental flyer outlining key points and what to do if an overdose happens on campus. So I'm very fortunate, I'm very grateful to announce that these efforts have reached over 11,000 students across 8 middle schools and high schools, and the Folsom Police Foundation has adopted these videos for future use, which means there'll be an even increased impact in the future and years to come. And so at its core, my project really emphasizes prevention, right? So by educating ourselves, we could reduce future harm because every life saved matters. Because behind every statistic, it's not just it's really not just a number. It's a real person. It's a real devastated family that got torn apart just because of an overdose that could have been prevented. And so while opioid overdoses kind of dropped nationally in 2024, which is really, really good, this crisis is still something that is urgent and it's still something that's very prevalent in today's society, which and it shouldn't be. And it should take, and it takes a lot more than a few individuals to solve this problem. It really takes a whole community to come together and do good for this problem. And so I kind of want to close with something that's really like stuck to me genuinely to this day. And it was from the interview that I had with one of the doctors in my project. And it goes like, if knowledge can prevent pain, then education is the most powerful medicine we have. So I want to leave you all with that thought right now. And so yeah, here are the references. I'd like to thank the 2025 Global Health Leaders Conference team as well as the audience. And thank you for watching. And if you'd like to connect with me, here are some of my socials. Thank you.